Hi, everyone. Welcome. We're really glad you're here with us today. I'm Scott from Blue Circle Health, and today we're talking about something that comes up a lot in the type 1 diabetes community, but can sometimes feel intimidating or unclear, and that is advocacy. Many of us feel the impact of policy decisions every single day, whether that's insurance rules, access to insulin and devices, prior authorizations, etc. But most of us were never really taught how those decisions actually get made or how regular people with diabetes can influence them. And that's why I'm really excited about this conversation. Today, we're joined by guests from DPAC, which stands for Diabetes Patient Advocacy Coalition. DPAC focuses on making diabetes advocacy more accessible, more practical, and more human, especially for people who are just trying to live their lives with diabetes and don't really have extra time or energy to spare. I definitely put myself in that category. So we're joined today by Erin Callahan, Chief Operating Officer at DPAC, and Jake Johnston, a member of DPAC's board. Together, they bring deep policy experience and a real understanding of what it's like to live with and advocate from lived experience. But before we get going too far, I do need to cover some quick housekeeping items, and then we'll get started. So we welcome and encourage you to use the chat feature along the way. I will keep an eye on it throughout the session if you need anything during the presentation. The session is being recorded. Participation in this event is completely voluntary, and anything you share in the chat may be visible to others. We are not providing medical advice. For personalized guidance, we'll always encourage you to talk to your healthcare team. And finally, for anyone who's not familiar with Blue Circle Health, stick around and I'll cover a brief introduction as we get near the end of the conversation here. So our goal tonight is simple. It's to introduce DPAC, to break down what advocacy actually looks like in real life, and to show how it doesn't have to be complicated, overwhelming, or all or nothing. So whether advocacy is brand new to you or something you've been curious about, but maybe never quite stepped into, you are in the right place. So Erin and Jake, thank you both for being here. Let me get Erin on the screen here along with Jake, and there we go. Erin, I'm sorry I caught you with your mouthful. That was I was not a good host in that moment, but wonderful for you to be here. I gave you no warning whatsoever. We're going to laugh about that the next time we see each other, right? Well, at this point, I would love for you and Jake to introduce yourself and tell us a little bit about you and your background. And I'm going to get the slides on the screen here, and you guys can take it from there. And then when you're done with slides, I'll get us all back on the screen and we can have a good conversation.
Great. Thanks, Scott.
Sounds good.
Great. Well, I can get us started. Hi, everybody. Scott, thanks so much for having us. I'm Erin Callahan. I'm the Chief Operating Officer of the Diabetes Leadership Council and the Diabetes Patient Advocacy Coalition. I think we're going to get into maybe another slide eventually that can help set the background for that. I am getting a little bit of background noise. I'm not sure where that's coming from. Jake, I'm not sure if you're hearing that, but it's a lot of public feedback.
I think it's okay for now. Let's just keep running with it, and I'll see if I can adjust some things on the back end here.
Okay, great. Jake, you're very capable of introducing yourself, and I certainly could not do your experience and expertise justice. But Jake Johnston is a board member of the Diabetes Patient Advocacy Coalition. Please go ahead.
It's great to be with you all today. Thank you, Scott, for the opportunity to come and talk to folks. I am a volunteer with DPAC. I'm a volunteer board member. I live with type 1 diabetes and have for many decades. And I also have a daughter who is in college also with type 1. So I get to wear both the type 1 and the type 3 hats as well. One of the reasons that I joined the DPAC board, and one of my background, is that I'm the founder of an organization out here in the Pacific Northwest called Connected, which is an organization that tries to bring people together to meet the social and emotional needs of people with type 1 diabetes. And professionally, I spent about a decade working on Capitol Hill, working in Congress, working on health policy. And so it's the intersection of all of those things, the type 1 community, the experience, and the policy advocacy that makes me excited to be a part of DPAC and a part of this experience today. One other thing, we're joined in the background by another DPAC staff member, Amanda Kaufman, who is managing the slides behind us, but is also really in charge of our social media team. So if you interact with DPAC online, Amanda is the voice behind the words on the screen. We're really pleased to have her here as well. And finally, before I turn it back over to Erin, I'll just say that Erin is based in Chicago. I am based out in Seattle, Washington. And between the two of us, those are the two greatest cities in America. So I'll let you all determine which is which. We all know what it is. Back to you, Erin.
Jake, being in Seattle, one time Jake reminded me that Seattle is the Emerald City, and I said, well, where do you think the yellow brick starts, pal? So we are happy to bookend some of the greatest cities in the country between the two of us. There's also a lot of great policy that happens, not only between Seattle and Chicago, but also on the outskirts of those. We do a lot of work, and DPAC works in all 50 states. We also work at the federal level. As I mentioned, we have two organizations that are affiliated. Today, we're here on behalf of DPAC, the Diabetes Patient Advocacy Coalition. DPAC is a 501c4 organization. That means that we are not bound to any thresholds for lobbying. The Diabetes Leadership Council, which is our affiliate organization, is a policy shop. They are a traditional 501c3 nonprofit, just like many of our partners. Because all that we do is policy advocacy, you hit a 10% threshold of lobbying pretty darn quick when that's the majority of your activities. So DPAC and DLC became affiliated back in 2020, right around pandemic time. They were started as individual organizations. We are pleased that our staff and our priorities are shared, or wear one hat or the other. We do have two separate boards. And for that reason, we keep the policy part and the education part separate from the advocacy part. The Diabetes Leadership Council is made up of volunteers, and our volunteers are board members. They have hundreds of years of lived experience, caregiving experience, clinical, pharmacy, research, you name it, we've got it, experience in diabetes. And then DPAC turns that policy into action. We have over 50,000 grassroots advocates nationwide. We represent all 50 states. And we work, again, at the state level and also at the federal level. We also work with employers to ensure that they're aware of good plan design for people with diabetes. Jake and I are not the only people that we represent that live with diabetes. We know that y'all are out there living in the deepest, darkest corners, sometimes in the halls of Congress already, on stages, various platforms. And we love that you use that, because advocacy does mean a lot of things. It's not just walking the halls of Congress. It's not just calling your legislator or submitting a letter or clicking a couple of times, as we sometimes ask you to do with a very low lift. That is advocacy. But advocacy is also in our personal lives too. It means speaking up for ourselves. It means standing up to our employers. It means saying, I need a break. Sometimes, particularly those of us living with diabetes that know that it is relentless and it does not take a break, we know that it can be hard to say, I need a moment. And that is advocacy too. And we encourage that at all levels of your personal life and your professional life. And of course, through groups like DPAC. Let's take a look at the next slide. Awesome. Thank you. One of the things that we do best is to keep the community informed. Jake, you have been doing this for a lot longer than I have. And I know that you mentioned that Amanda does an incredible job for us professionally by keeping our community informed. Can you talk a little bit about how we do it?
Or type 1 advocate community. The first thing is that we send out regular communication via email and also through the social media channels to make sure that when there are policies that impact people with type 1 diabetes and type 2 diabetes, that they are aware of it, and we can basically motivate the community into taking action. And where DPAC really thrives is at that intersection of not only kind of what is going on, why is it important, but also when your phone calls and your advocacy make the most impact. And so that's really what we try to do at a global or on a national scale here, at both the federal and the state level. The other thing that DPAC does that I hope all of you get to familiarize yourself with is that we do advocacy training. We do this at diabetes conferences and events, but we also have what is just an amazing program, which is that we do a Hill Day every year in Washington, D.C., where we invite people to apply to become advocates and champions and coming to Congress to advocate for these policies that impact so many people. It's an amazing opportunity to get an in-depth kind of advocacy experience and to also just bond with other people who are passionate about making a change in these issues right now. Back to you, Erin.
Thank you. On the topic of our Hill Day, we are currently recruiting advocates to apply for our Hill Day. It's coming up in late June. You can see a couple of the pictures here. I know back in that first shot, that's always the fun one, right? Like that's the one that everybody does it for. It's that shot on the Capitol. Right now, if you follow us on our social media channels, you will absolutely see opportunities to submit that application. We also encourage you to sign up as an advocate with DPAC. We'll keep you informed. We do not abuse the privilege of having your email address. I think I probably spend as much time being automatically subscribed to various things as I do clicking the unsubscribe button on things when I see a little bit too much from anybody. But DPAC, we just send out a monthly newsletter. We try to keep it super simple. I'll be honest with you, I am a little bit older than a TikTok generation, but I have fallen into the traps of, consuming things at a very quick level, at a very quick pace, and by not reading too much anymore, unfortunately. So we try to keep up with that pace too. We advise on what's happening at us in bullets, which I think is really easy to consume. We make things relevant to you, and big kudos to Amanda for translating sometimes things that are super wonky into things that are very relevant to our everyday lives. And that's really been our secret sauce to keeping our advocates informed and letting you know what is relevant to you. I think we can probably go to the next slide. Great. So we do this through, previous one. There we go. So in addition to that Hill Day, that monthly newsletter that we call the Policy Pulse, we also have our Champion Court. These are our hand raisers. They're the folks who say, we want to do more. We know a little bit, but we know that there's a lot to learn. We encourage you to get in touch with us, either through emailing us, through any of our socials, to say that you want to be a part. You want to know a little bit more about what we do. You want to get involved. Being an advocate means a lot of things. Sometimes it works quietly in the background, doing some research. We do a lot of the real wonky stuff. We encourage you to become an advocate in all aspects of your life too. I like to share this story, and I'm an adult, so I can say these things. I was diagnosed with type 1 diabetes when I was in first grade. When I was in second grade, Philip Lawson told the whole class that I had fartabetes. And I tattled on him. And because that was like the worst thing you could say when you're 8 years old. And that was not cool. And I spoke up for myself. So I'm not going to say what happened to Philip Lawson at my grade school, but I never heard fartabetes again until I started sharing this story. And that's advocacy too. It means speaking up for yourself. Sometimes it means talking with your doctor and saying, this isn't working for me. It means saying, I deserve more. I know that I'm worth more and I want to do a little bit more. Sometimes it means saying, I've had enough and I don't care to talk about this anymore. You have absolutely every right to do that because this is your diabetes, it's your journey, and it's your experience. Jake and I have very different perspectives on what does a great endocrinologist do for you. I like somebody who knows everything and can tell me what to do because I want somebody who can control a lot of things for me. Jake, you and I have had the conversation where you said, no, I love getting folks that are right out of med school and in their fellowship and learning so that I can help them and mold them and tell them what works for me. And I think everybody has their own perspective here. So that is super helpful to know what you want. Why are you shaking your head at me?
I want a medical professional who writes my scripts and gets out of my way.
fair enough. I want a little bit more attention, I guess. Maybe this speaks to the people that we are behind the screen too. I think the next screen is going to show maybe a QR code. Yep, sure is. That is going to be the quickest path to becoming a champion of ours. And so that is going to project you into the DPAC universe and get you signed up for that policy pulse where you'll hear a little bit more information about us. These are our social handles. We encourage you to join them. Diabetes PAC on Instagram and X, and Diabetes Patient Advocacy Coalition on Facebook and LinkedIn. We are most active on Instagram. That's where we're seeing a lot of our activity. We send out polls. We ask for people to participate in things that we're doing. I think right now we're looking for people who have maybe been diagnosed with gestational diabetes. We're doing a lot of work on diabetes technology and in pregnancy. We would love to hear from you if you know anybody who has had that experience and would like to share it with us. And that's an overview of DPAC. But I know we've got a lot of questions that are coming in either live or that, Scott, you've coordinated for us or amassed in the background or have heard in all of your great community work. We know that we're not alone. You don't know diabetes if you don't know Scott Johnston. And we're here with you.
Yeah, you're too kind, Erin. Thank you. It was a wonderful summary. As someone who's happily subscribed to all of the DPAC emails, I can attest to the fact that it's very quick and easy. It's not too frequent. It's right on time. I also think that your system, when it's time to take action for contacting my representatives, is one of the easiest that I've ever used in any of the organizations. And I know that the ease that I experience on my side of it only comes from a lot of hard work on the back end. So thank you. And for anyone who may not know what I'm talking about there, should I let one of you two explain what that's all about, or what's the best way to go about that?
I want to credit our team who works super hard every day, not only on the back end on that, the quick clickability, I guess, and the ease of DPAC, also on the translation, which we know Amanda does a tremendous job of, but also our policy team that work both at the federal and the state levels. But Jake, maybe you can talk a little bit more about how we put that into action. And then Scott, we'd love to hear from you about your experience with that to round it out.
Great.
Yeah, I think DPAC works in so many different ways, right? And advocacy takes so many different forms. But one of the things that we're talking about now with Scott's question is when there is the need to mobilize the community to engage on a policy issue, right? We try to make it as easy as possible where you can do the absolute bare minimum, which is kind of add your name to the cause, right? And this is kind of a click-through strategy to make sure that your opinion is registered at either the state or the federal level at the right time in the right office. But also it gives you a platform to go deeper on the policy. Say like, I don't know how I feel about this, or I want to learn more. So all of those links are included as well, where you can go deeper and deeper kind of to try to build your own expertise about the issues themselves. Where, again, I said this earlier, but I'll say it again, where I think DPAC really shines is not creating urgency around issues that don't have urgency to them. We try to be really, really strategic in terms of, hey, right now is the time because there's an open comment period on how Medicare is going to handle treating insulin pumps. We need to get comments in the next 30 days. And so there's kind of a time generation that we really prioritize for that. Or we see a bill coming through committee, or we're trying to get co-sponsors for something. So there's a strategic initiative in terms of how we want the community to engage. So we're not just asking for the right thing at the wrong time, which does dilute the message.
Yeah, that and again, that really comes through. And from my experience, what will happen is I'll get an email in my inbox, and it will have some high level information about what the issue is, what's going on, and what's asked of me. And when I click a button that says, I want to send a message, it basically if I'm not already registered in the DPAC system, it will ask me some very basic information, and then that information is used to find out who are my representatives in this issue. And it pre-populates a very nicely written and thoughtful email message, and it gives me an opportunity to add some of my own personal information, share a bit of my story, and that's a key piece of it that we're going to talk about a little bit more. And then I hit a button, and it's like it magically goes to all the right people. And what I usually experience shortly after that is I'll get a response from that representative's office. I actually will usually get two responses. The first one is an acknowledgement. Hey, we've received your communication. Thank you for writing. And then typically a few days later, I'll get a longer message from that office describing their stance on the issue, thanking me for my input, things like that. And it's not something where, they're not always going to give you what you ask for. These are often very complicated issues, and but it makes me feel like I'm making a dent in a big issue. And I think that many of us are under the misconception that it takes a ton of communications to hit an office before they sort of take notice and start considering how they think about it or how they communicate about it. But I think that number is actually much smaller than what we might think. Do you guys have, Jake and Erin, any insight on the volume of messages before it starts to raise some antennae at the office?
Yeah, I can take this one. So when I was a congressional staffer, there truly are an infinite number of issues that come in through the door, right? So how does an office decide kind of what is important and what is not important? And one of the things that every office does, and it is just how Congress works, doesn't matter if you're Republican or Democrat or a senator or member of the House, is that every week you generate kind of a constituent contact report. And the boss wants to see that. They want to know who's calling in, what are the issues, kind of is there a pro and a con, kind of, they really want to get a sense of like, what are people talking about? And so as you can imagine, the issues of the moment, whether it's the economy or the war, kind of all these things, they do tend to kind of take up the oxygen at the upper end of that scale. But then there's all these other things where there were random one-off comments, and those tend to fall off. And so the number to really make a difference is not that high. It can be as low as 10 or 20 before you make the front page of that list and what that does. So just so we're clear, having 20 contacts to a congressional office does not automatically get you what you want. But what it does do is it forces the office to take that issue seriously. So they're like, I don't know why, but there's 20 people with diabetes contacting our office about this issue. So we'd better figure out what is our position on the issue and how we're going to communicate back to these people about it. Because clearly there's something out there in the woods that we're not, paying attention to. So it forces the office to go on the record, and it forces them to create a communications channel back to the community. What that does for DPAC then is we start running our whip counts, and we start, seeing where the opposition is, where the supporters are, and kind of where do we need to target more resources. And it's part of that mechanism of actually affecting enough of a majority to enact a positive change. Or in America, preventing bad things from happening too. I guess we can look at it both ways.
Yeah, thank you for that.
Sorry, Scott, I'm sorry.
No, that's quite all right. It gives us a lot of context and a lot of color. And again, I'm just shocked at how low that number is, where we can start to at least get on the radar, right? And that I think that's really empowering. It's if I feel like I'm working and contributing to something where, it's not making much of a difference, it doesn't feel as good. But if I know that if all I need to do is add that number up to 20, I can be one of 20 pretty easily. So thank you for that.
And you bring up a good point, Scott, about, making a dent. And I think to Jake's point about we may not, just having 20 people get in touch with a member of Congress does not mean that we're going to get what we want.
Right.
this is a long game. It's a really long game, and we have to celebrate the steps that are wins along the way to get the thing that we want, right? We do a lot of work in a lot of different policy arenas, and it's important to note that policy is very different than politics. And we deal with both every single day. In any negotiation, which is all the work that we do is, there are going to be some concessions. There are going to be some things that we say, we have to draw a line here, and we're not okay with this. But there have to be some things that we as an organization and as a community say, you know what, this isn't exactly what we asked for, but we're okay with this as long as we're still working towards something else. I think it's very easy, especially in this era of big communications, let's say, right? And a lot of social groundswell, which is really important for the work that we do, to be able to talk about facts with facts. And DPAC as an organization, as we've seen changes in the administration, as we've seen changes in certain districts, as we've seen changes happening at the state level and at the federal level in very different ways, which creates a push-pull in ways that we simply haven't seen in my life and career. We had to come together and say, how are we going to address a lot of things that are coming out that we know not to be true? Do we try to fight them? Do we try to say, we hear this is happening, but this is what we know? And the conclusion that we came to as a board and as a staff and as leadership of this organization and with this community is to talk about facts with facts. To not restate things that may be myths, to not restate things that may not be exactly what we wanted, but how do we fudge them to sound like something that's good and better for our community? But in truth, to talk about fact, to only talk about facts, and to only do that with facts.
I really appreciate that. It makes it clear. Yeah. And that comes through in everything that I see from the organization. So, and I know those decisions don't come easily, especially with everything going on. Can we talk a little bit more about how DPAC decides which policy issues to focus on, especially when there are so many things out there that have an impact on people living with diabetes?
Yeah.
You're also asking, no, let me go first. What you're also asking, Scott, is how does the volunteer board tell Erin to work on everything everywhere all at once? And the real question is, how does Erin and the rest of the staff filter down kind of our requests? Because the board is also the diabetes community, right? So we want to be everywhere all the time. And Erin, how do you manage us?
Volunteer management has always been the best part of my job. I think if you talk to anybody who's worked in nonprofit, they would agree very cheekily. We understand, much like members of Congress, we take in a lot of the things that our board and that our community is talking about. We have to try to distill where it makes sense for us to take action. Yeah. We have to try to distill what has momentum, what has potential to be the right vehicle to victory. And victory is success for our whole community. It's not success for one thing that we have really hung our hat on. It's allowing us to say, okay, have we talked with other members of possibly the chronic disease community? Have we consulted with our partners in diabetes advocacy? We work extraordinarily closely with all partners across the diabetes community, including Blue Circle Health, also including those who have a more robust advocacy arm, like the American Diabetes Association, like Breakthrough T1D. We, in fact, represent many organizations and their advocacy considerations. If it's not something that is that's a core competency or a core strength of that organization, we're happy to consult with any of our friends in the diabetes community. In fact, in June of 2026 for DPAC's Hill Day, this is now the second year that we're expanding it into a diabetes community Hill Day, where we're not only inviting, but encouraging our partners across the whole diabetes community to join us in DC. We know that we've invited Blue Circle Health. We can't wait for you to join us. We hope that we can make that a reality. But in addition to our grassroots advocates, who follow the traditional application process to join us, we also want to be able to link arms with the whole community and say, we're in this together. This is, as George Huntley, our CEO, says, this is not a competition. It's a community and it's a collaboration, and we can only do it when we're together. Jake.
Yeah, one more thing too. Scott, on the DPAC website, we have a state-by-state scorecard, which is one of the things that we do to try to prioritize decision making. So if you are joining us from Ohio or Pennsylvania or Texas or the great state of Washington, you can actually pull up your state and kind of get an idea of like, where is my state ahead of the game in terms of taking care of the diabetes community? Where's the work that still needs to be done? And we kind of have a green light, red light, yellow light, right? Like what's past, what is not being worked on at this moment, and kind of what's still in process. That also helps us dictate kind of where to put resources and where to put attention is where we think we have some fights that we can win. So it's kind of a combination of a lot of factors, but I do want to make sure that the state handbooks is something that we talk about.
Yeah, and I've definitely seen and appreciated that that resource. So thank you for that, and I'll be sure that makes it into the show notes and the replay description as well. I think it's a really valuable resource. When you mentioned the applications for Hill Day, can you share a little bit about what someone should expect to experience? Let's say they see it on social media and they apply. What's next? Do they hear something within, like depends on how fast Amanda can get back to them, or what's the process?
Jake was part of building this process for this year, and I've been in it. I've been working on it for the last couple of years, so I can speak to generally what to expect, and maybe Jake can talk about the importance of the application and what we're looking for in an applicant. So right now our applications are open. We have not announced a deadline for those applications, and we did that on purpose because we want to make sure that folks are able to do this as they can, that we're hearing from you in a way that is authentic to yourself as an applicant. We will announce that there is a deadline at some point. It's just not yet. We'll give you a little bit of time before we say it's closed for now. But the applications are all going to be reviewed in a blinded process because we are looking for authenticity in the responses, of course. In some cases, we may target some districts, some specific districts that have members of Congress that are in a committee of jurisdiction over some of the things that we're advocating for. But we want to make sure that we're representing our whole country and that we're representing our whole community, truly. We also ensure that there is no reason that anybody wouldn't be able to get to Hill Day. We offer reimbursement of most of the expenses. If there is a financial need, we want to make sure that that is not a barrier and that we're fully covering costs so that we can ensure that all voices are at the table as well. And Jake, maybe you can talk a little bit about the experience that we're looking for, which is not to say that you have to be a professional advocate, quite the opposite.
No, you do not have to be a professional advocate. You do need to be someone who cares, and you need to be someone who has maybe that audacity within themselves to think that they can join with others and get something done. It is an inspiring experience. Joining with other people and getting trained in like how to talk about these policies, and then walking into these offices and in a group getting to ask members of Congress who represent you to support you in these areas. It's an incredible experience. And we've seen unbelievable things happen as a result of it. We've seen relationships built, with these new policymakers. We've seen new co-sponsors taking on to bills, but most of all, we hear from the people who participate in this experience how impactful it was. This was not designed for this talk with you, Scott, but I actually just got an email last week from a participant in last year's DPAC Hill Day. And she reached out to me and she said, I wanted to thank you for the push to apply to Hill Day 2025. It was truly one of the best experiences of my adult life. It will be an honor to go again, to help push for some good for our community, but also selfishly to get to be in the company of other diabetics. Mm-hmm. And I just think it's an amazing experience. The last thing I want to say is that how to apply, it isn't about what you know. It is about how you are willing to use your voice. And I cannot emphasize that enough. The DPAC is here to be the policy depth, right? You are there to be the expert on what it is like to live with diabetes for yourself and in your family. There is nobody on earth who can tell that story better than you. And what Hill Day does is it creates a Venn diagram between what the policy goals are and what your personal story is. And then you've got a lot of support there to help people, steer the ship in the right direction. But we need people who are willing to be storytellers. So we need people who are willing to tell their story about why the cost of programs or technology or services is something that they have a barrier for right now. We need to know why research makes a difference. We need to know why covering technology is a critical component of quality care. We need to know that discrimination against people who live with a chronic illness is simply not okay. And like all of those experiences that you have and practice in your life on a daily basis, that is what the power of advocacy is. And I think for me, as somebody who will have a minor role in reviewing applications, I'm much more interested in your willingness to be a storyteller and to tell your story than I am in what type of I worked for this committee in a state legislative. That's not as important in this context.
Yeah, I'm so glad that you brought that up because I had the opportunity, what feels like a lifetime ago, to participate in another organization's government day, which sounds like a similar concept, right? Where you bring people together to teach them some of the basics about what advocacy looks like and how it's really more about the power of their personal story and how they are affected by all of the things that we juggle living with diabetes. And then through some very smart and tactful training, it's shaped into some very brief messages. Because when you go in and visit with an office, you've got, 5, 10, 15 minutes, maybe something like that to get these messages across. So I think you've helped paint a picture for people listening today. So thank you. One of the questions that we've got is around what is something you wish more adults with type 1 diabetes understood about how policy decisions are made behind the scenes? And I feel like that's a good one to go to next.
Jake, Jake very humbly has only introduced himself as a DPAC board member in his professional career. He knows how the sausage is made, as we say, and I'm from Chicago. I think I can use that phrase very confidently. So how the decisions are made, do you mean at a government level, at a legislative level? We talked a little bit about how we make the decisions at DPAC. Jake, perhaps you could give a little color based on your experience.
I think that what I wish more, you asked me just very bluntly, kind of what do I wish more people knew about the policymaking thing? And that is that obvious things are actually really hard to do. Affordable insulin is the most obvious thing in the world for people in our community. There's simply no debate about this at all, right?
Yeah.
But convincing policymakers to change regulatory systems and price structures and contract agreements takes an incredible amount of work. And sometimes we don't get all the way there at once. So, for example, we got the 35 insulin, but only for Medicare beneficiaries,
Sure.
which still leaves a fight ahead of us for the rest of the community who's not insured by Medicare. But that incremental progress was what was achievable in that moment. And it does make a difference and sets the foundation for future. So what I wish the community knew, I wish that everybody knew that sometimes incrementalism is actually a pathway to get to where we need to go. It just regrettably sometimes takes longer than it should.
I think most things take longer than they should. And that's, a fact of life often with diabetes. So that makes a lot of sense. I hadn't thought about it in that way.
There's a phrase I love. It's used in policy and politics a lot, but change happens much too slow until the precise moment when it happens too fast.
Mm.
Yes. Similar to, there are no overnight sensations, right?
Right.
it's a whole lot of buildup to that overnight. But Jake, you also bring up a good point about Medicare in particular. You mentioned that we saw the $35 insulin copay cap in Medicare. One thing I would love for advocates to know is that a lot of the decisions that are made in the commercial insurance market, so for people who get their insurance through an employer, or people who get their insurance through an exchange or healthcare.gov or an ACA plan, many of those principles follow the trend of Medicare. So Centers for Medicare and Medicaid Services, or colloquially CMS, we do a lot of work to change the minds of CMS and to change some of the decisions or influence the decisions of CMS, because they are the largest influence on the commercial insurance market. We love all people with diabetes equally. We do not favor those on Medicare for any reason other than they're the trendsetters and they're the ones that really set the standard. And those commercial insurers look to CMS and what they'll coverage, some of their coverage restrictions and rules and expansions to model their own activities after. That said, if we're looking for a Medicare to change something in Medicare, that applies to you too. Just because we're saying we're working on this with Medicare, please don't discredit that just because you're under the age of 65. That is absolutely going to be something that influences some of your choices and some of your options. Never mind the fact that our people are living longer than ever. And we're going to see some things that are hitting Medicare that they've never had to deal with before. And we want to be ahead of that curve.
Well, and it also kind of brings to mind too that even if it's if I feel like I'm not in that Medicare age group, there might be something about my personal story of living with diabetes that impacts the representative in just the right way to maybe tip a decision one way or another. So I will double down on what Erin said. Don't hold back just because it might be something related to Medicare. We had a really smart question from the team a while back as I was kind of floating this idea of talking about having DPAC come on. And the question is it less impactful if the representative office is seeing many copies of this same letter template, right? It's like they can pretty clearly tell that it's a template that was used and just certain parts were changed. Does that make it any less impactful, or is it still valuable?
I'll take that one. We have a thing a lot of people have it, but in DPAC we have something we call the advocacy ladder, right? And it's basically what is your level of engagement with the office? And to be very blunt, the first rung of the ladder is exactly what you just described, Scott. It is a form letter campaign that comes through the front door, and you're trying to socialize an issue and make it a priority in the office, kind of like we talked about earlier. These are often really effective when there's a member of Congress or a member of a state legislature that either we don't know where they're at on the issue and we want to open that door and figure it out, or we also want to make sure that we are putting it on the radar screen as an issue that they need to be paying attention to. But it is, to your point, it is not as effective as other strategies. The most effective strategies are meetings, like the Hill Day in Washington, D.C., or doing town hall meetings where you show up to a public town hall and get to ask a question about diabetes, or get to, at a state level, go testify before a committee that's doing a hearing. That is the top rung of the ladder. And there's probably a dozen spots up and down that rung that have different degrees of efficacy and that have different degrees of, frankly, time commitment that is required. What we ask for people that are interested in advocacy is for everybody to kind of self-assess what they're doing and then try to climb one rung on the ladder. So if you're somebody right now who is clicking on those DPAC emails and sending in the form letters, that is phenomenal. You are part of the team and we appreciate it. Can we move you one step up, which is actually to make a phone call or to send a personal email or to try to, request. There are things that we can do to try to continue to elevate that. But everything starts with that first point of contact. And so the easiest way to mobilize a community is to make it an accessible way to do so.
Yeah, again, that comes through very clear.
Yeah.
in those click advocacy campaigns, as we call them, click advocacy that you talked about participating in, Scott, as you mentioned, we give an opportunity to personalize that a bit too. Mm-hmm. So you don't have to do that. And we make it easy so that you can just click twice and say, this is, my zip code, and send those letters. But you can also add a little bit of something to it that is going to be, think about if you were receiving all those letters, it's going to be a little bit more interesting if somebody writes you a personal note. They're going to read that. And the best strategy is to have a strategy at all. And that's the role that DPAC plays in all of this. That's why we offer the opportunities to just send the form letter, for you to be able to personalize it if you'd like. And I want everyone to know that we are meeting in person, or we are meeting virtually with members of Congress every single week, if not every single day. There are days that I sit here and I click from one meeting to another, to another, to another, and have the same conversation 10 times with different members and their staff. That's our job. And we make sure that we're raising the profile of DPAC in the diabetes community at some of those bigger events, like our Hill Day, and like any virtual opportunities, like testifying in front of CMS, for example, on your experience with one of the drugs that is up for the Inflation Reduction Act price negotiation. We're doing that right now, and we work every single day to contribute to that larger strategy.
Yeah, great. Thank you for sharing about that. Can either of you share an example of a time when a patient voice actually influenced a policy decision, or maybe shifted a conversation one way or another?
Can I go?
Please.
So this one isn't recent, but it's my favorite story of how this works. So back in I believe it was 10, might be a year off on this, but in 2010, the state of Washington, in their infinite wisdom, was going through a process to try to figure out, how do we save money at a state level on healthcare? And one of the things that they identified and came out as a recommendation was, this was back before CGMs were prevalent, and they decided that they would only reimburse through the Medicaid program for one blood glucose test per day. Mm-hmm. And, some tremendous cost savings to the state of Washington if that policy were to go forward. It was obviously catastrophic to our community. So there was nobody from the diabetes community that was consulted before this recommendation was made to the governor's office. And so what we were able to do is mobilize hundreds of people to basically tell a story of, like, how do you use blood glucose monitoring, and why is this an asinine and idiotic decision? And, let's try to do the right thing here and not hurt people's healthcare to try to save a few pennies. And the result was that recommendation was pulled out of the final process. And it was a direct case of, it was in there, patients mobilized, patients told the stories. It was a very easy thing to communicate to people and have them kind of feel some outrage about. And then we got exactly the result that we wanted. I just love that, because it's an A to B example of the question that you asked.
I can give an example on a different plane, but how personal advocacy helped influence change. DPAC was at a Children with Diabetes Friends for Life conference a couple of summers ago, and we give presentations on how to become an advocate, what's happening at your state and federal level. We also talk about insurance and how to choose an insurance plan, and making decisions based on coverage and formulary change and all of those things that we deal with all the time. In the exhibit hall at our booth, a young woman came up to us and said, I have a daughter who has type 1 diabetes. And at my job, I recently received a promotion. And so we no longer qualify for any sort of aid. And I'm actually making too much money to qualify for assistance. So I have to, my daughter is on our insurance now, but our insurance is only covering one CGM, not the one that works with her pump in her AID. She said, I can't afford to pay out of pocket for the other because I'm now paying more money for our insurance. She couldn't afford her promotion. But also my daughter is no longer able to get the CGM that works with her pump. What do I do?
Yeah.
And we helped her. She worked for a large chain. And we said, you can work with your HR department, talk to your benefits consultant at the HR department and say, this is my story and here's what's happening. And I'm a committed employee and I want to stay here and I appreciate the opportunities that I've been given. So we worked with her on some talking points in advocating for herself and for her child. And that HR department opened up their coverage to cover all CGMs in diabetes. So it makes me a little bit emotional that she was not only able to help her daughter and her family immediately, but the thousands, if not tens of thousands of people that work for that company by speaking up and saying, not only speaking up for herself in that moment with us and saying, I need help, but also speaking up for herself within her own locus of control and within her own, sphere of influence, and was able to help all of us.
Those are both amazing stories. And it's great examples of just how sharing your story and talking with the right people in the right ways with a little bit of guidance can make a huge difference. When it comes to people who might be feeling a little angry or burned out, for the many issues that we wrestle with in diabetes, how can advocacy be a healthy outlet for kind of channeling that energy instead of feeling like maybe another burden?
I like to say that I'm in my rage era, Scott, and I don't know if this is a certain time of my life or environmental factors or coming up on 40 years with diabetes or all the volunteer management that I love so much. But I think any opportunity that I have to use my voice and to speak up and to kind of take a stand for something really feels like an opportunity to get a little bit of aggression out. Someone the other day casually suggested to me that I get one of those little punching bags that just go on like a stand in my living room so I could maybe get something out in that way. But this is another outlet, I think, for me as an individual that's living with all of these burdens and all these challenges, all these great opportunities too, if I'm putting my Disney spin on things, and I usually try to. But it helps to know that I'm speaking out for not only myself, but also my whole community.
How might, if there are people out there that feel maybe distrustful of the big system, those are valid feelings, right? How do you encourage their engagement without also just minimizing those feelings that they're experiencing?
It's hard. I mean, those feelings are legitimate and those feelings are real. And, the best thing we can do is kind of what Erin said right away, is that we try to use facts and we try to use strategy to leverage voices and action at the right time to make a difference. And when you see that difference happening, and sometimes maybe it's a passive difference, Scott, maybe it's a member of Congress wrote you back and said, hey, thanks for contacting me about this issue. It's on my radar screen now. Thank you for bringing it to my attention. Maybe that's not the goal, but it's an incremental step towards where we're trying to get, right?
Yeah.
And then I think, just a little bit bigger picture, being able to win a couple fights feels amazing if you were a part of the fight. And I don't know if anybody hasn't ever had that experience. It is exhilarating. And I'm not talking about like at a congressional level either. I'm talking about getting your kid to not be benched at the end of a basketball game because the coach is worried they'll go low at the free throw line. I'm talking about like anytime you can make a change in a system that you were a part of or a victim of or a participant in, it is an incredibly cool thing to feel. And it is a way to feel like despite how broken a lot of things feel right now, there's still people that care about making a difference. And there's people who want to work collaboratively with others to try to make a better future. It's inspiring. I get fed by this, and I have the same rage moments that Erin does reading the newspaper, but I get fed by working with people who live with diabetes and trying to like leverage your voices in a positive way.
Yeah, there is something really, really moving about contributing to an effort and seeing, even if you don't see the result that you hope for or dream for, you can see the needle moving a little bit and feel like it wasn't for nothing. So that makes a big difference. A couple of really good questions from the audience today before we start to wrap things up, but there often seem to be unintended consequences with a lot of things, right? Are there any examples that either of you can think of diabetes policies that maybe sounded good on paper, but ended up causing real trouble for people living with type 1 diabetes?
Jake, I think you have this.
Great.
I'll start with a broad sort of reaction to this question and give you some time to think, Jake. Nothing exists in a vacuum, especially in policy and advocacy. So when one decision, if you think of a balloon, like a big sort of long, you make a balloon animal out of it, balloon, something that is squeezed here is putting pressure over here.
Sure.
So it is really important to know and to recognize when you're asking for something that it's going to push or pull on something else over here. There are always going to be unintended consequences. The role of DPAC and the earnest way in which we approach everything that we do and the truly holistic and community approach that we take to it is to try to mitigate those unintended consequences and to mitigate the harmful consequences and to create a space that either has a path to absorbing the more challenging and prickly ones, or to find a place that we can deal with some of those pricklier consequences and how we're going to kick that can down the road a little bit and deal with it in a different way.
Yeah, that's great. I mean, Jake, you mentioned the Washington test strip issue, right? That's one example that sounded good to the budget makers on paper, but would have been disastrous for us.
Well, I was going to say, I think that a lot of the examples of like a good idea that maybe had unintended consequences deal with that combination of cost versus access, right?
Yeah.
Because a lot of times what we're fighting for in the diabetes community is having either lower costs or expanded access to something. And in doing so, sometimes those same systems say like, okay, fine, we will give you this type of technology or this type of medication, but in doing so, we're going to limit the spectrum of that, what's in that category, to try to make sure that we can limit our costs in order to provide that to you. So I think that a lot of the space that we're in is both, both trying to expand access and reduce costs simultaneously, which are sometimes at cross purposes.
Yeah, that sounds like a really hard thing to do, for sure. Well, we've got time for one last question here. And it's about, Erin, you talked about this a little bit earlier, but how does DPAC work with other diabetes organizations without maybe duplicating efforts or competing for attention? We're in a crowded space here, and I imagine that's a pretty difficult balance. I'd love to hear more about it.
I can start. I don't know that it's a crowded space. It doesn't feel crowded. It feels very comfortable for us, actually.
Good.
I joined DLC and DPAC. I came from the American Diabetes Association. And we are, like I said, we link arms with everybody. It is very silly in this resource-limited environment. By resources, I don't just mean money. I mean time. I mean the attention that we get from lawmakers. I mean the consideration that we get from those who are creating new innovation, right? We don't want to waste it. So we want to make sure that we are speaking the same message and that we are in unison, that we're singing from the same songbook, that we're not competing for that attention that is limited or those resources that are limited, so that we can put all of our collective energy behind, someone who may be leading in one area or some organization that's leading in one area. We don't want to go to the Diabetes Caucus with a message that's wildly different from one another. We want to go as a united front as the diabetes community, regardless of what name and color is on our logo. We need to know, because frankly, nobody knows about that except us. We're the only ones who know the difference between the organizations. If you're on the outside of diabetes, you're not really thinking about, who's funded by who's got more advocates this, and who's saying this over that, or who's the CEO or chief blah blah of wherever. You're just thinking diabetes. And if I continue to hear different messages from the diabetes community, I've lost interest. So it's really on us as leaders in our community to be able to say, how do we work on this together? And I'm pleased to say that I think we do that really well.
And one follow-up comment on that too is that we all kind of do a gap analysis, right? So where are some orgs strong and where are there gaps in the policy landscape? One of the gaps that DPAC fills is that there's not always state level advocacy taking place across the country. And, Breakthrough T1D doesn't do any state advocacy work, and ADA's resources are focused in certain areas and certain priorities. So this is a place where there's a gap, there's a need, and this is one where DPAC can come in and invite Breakthrough and invite ADA to sign on to kind of the work that we do. Conversely, Breakthrough's got a great reputation on, fighting for diabetes research funding at the federal level. And we're happy to let them take the lead on that and be part of their team as they go in and fight that fight. So I agree there 100%. There's not enough resources in this community. We all try to work strategically and collaboratively to make sure that we present a community and not an organization.
I love that. Such a great point. And I think as someone living with diabetes, just feels nice when I see the organizations that are part of my life in diabetes working together and collaborating. It just makes me feel good. Well, we've covered a lot of ground. Great questions, great discussion, great input from the audience members. I would like an opportunity to give you both an opportunity to share any closing thoughts or maybe touch on something I maybe haven't asked about. And Erin, I'll start with you if that's okay.
Sure. I hadn't planned for this, but something that I say about advocacy is, I did mention this a bit earlier, you have to celebrate the small wins. And I mentioned that DPAC really approaches this in a very earnest way. If you've heard me say this once, you've heard me say it a million times. It takes a golden retriever attitude. And our team has that. We wake up every morning and think, I'm going to change the world today. And then we go to bed every night and we're like, oh, I'm going to try again tomorrow, and leave that attitude and that energy to us, especially if you're feeling like the system is hurting you or it's harmful or it's not made for you. You can always continue to look to us in any of the channels that we recommended, and we'll be here every morning and every evening with exactly that perspective, and we'll keep fighting for you.
Very well said, Erin. Thank you. Jake, anything from your side?
Yeah, I'm a volunteer. I've always been a volunteer in the diabetes community. I've never had a job kind of on this side of my life. And I just wanted to give an open invitation and a warm welcome to anybody who wants to dive a little bit deeper. It is a community, it's a cause, and it's fun. And the people that are involved are motivated by change and motivated by trying to make things a little bit easier for the person who follows after. It is inspiring, and it's a way to connect with your disease, but it's a way to connect with other people that are just wired the same way you are. One of the things that I'm super proud of at DPAC is that we make it accessible, which means that if you would like to be a champion for us, we'll help you learn the policies. We'll help you train up on how to be a great advocate. And we'll, hopefully plug you into great opportunities where your voice can really make a strategic difference. But no need to overcomplicate it. We could use all the help we can get. And your participation today shows that you're interested in these causes. Please kick the tires on DPAC and try us out. We'd love to have you there.
Yeah, I really appreciate that, Jake. Thank you. And I definitely am going to be looking at what can I do to step up another rung on that advocacy ladder. So thank you for describing it that way. All right, for everyone who joined us tonight, I hope you're leaving with a clearer sense that advocacy doesn't have to be complicated, and that even small moments of awareness and engagement add up, especially when they're grounded in your lived experience. If you want to learn more about the work of the Diabetes Patient Advocacy Coalition, or DPAC, as we say, or stay connected in a way that fits your life, visit diabetespac.org. And we'll also make sure that links and resources are shared with you after the webinar. Erin, Jake, and Amanda, thank you all for your time, your clarity, for meeting people where they are. You really make advocacy feel more human, more doable, and honestly much less intimidating. And that really, really matters. So as I move into the last few minutes of housekeeping, feel free to drop off. I'll take you off the screen here. And I look forward to connecting and doing more. Thanks, everyone.
Thanks.
All right. So remember to check out our website events page to stay up to date on future Blue Circle Health events. That is at bluecirclehealth.org/events. Our next event is April 9th with Jenny from Diabetes Digital. She's talking about releasing guilt and shame around blood sugars. We also have new podcast episodes releasing every 2 weeks. The podcast is called Around the Circle, Living Well with T1D. And you can also find information on the podcast along with links to recent episodes under the news section of our website. I don't see any other questions. So at this point, I'm going to go ahead and end this webinar, but I will get a recording out within the next few days. And thank you, everyone, for coming. See you next time.